taking Paxlovid for COVID-19 raise your risk for a rebound? The manufacturer, Pfizer, says no, but there's a new study out that says yes. Here to sort it all out with us is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Thank you for being here in the newsroom.
Good to be here.
When this first came out, you said Paxlovid, absolutely take it. This is unbelievable. You still stand by that?
I did, and I still stand by it. Why? Because the highest risk people who have the highest risk of hospitalization, death, Paxlovid decreases your likelihood of dying from COVID-19 and from being hospitalized. But those are the highest risk people. Standard risk should not be taking Paxlovid.
Should not be taking it. So you have, what's in the highest risk category? Just remind us.
Immunocompromised patients, elderly,
Yep.
patients with chronic lung, heart disease.
So this is a small study. What can you tell us about this?
Right. It's a small study, and a lot of it was done in Boston at many of the Harvard hospitals, Mass General, Brigham, and other places. So the good news is this. There were 120 patients that had COVID. About 70 of them were given Paxlovid. The other 50 were not given Paxlovid. And what was surprising about the study is that 20% of the patients that were given Paxlovid had that viral rebound after stopping it. It's something, if you remember, that we all thought, we've seen it, I've seen this in many patients, but the clinical trials prior to that hadn't shown that. The percentages of rebound were much lower, 2% or so. One of the major reasons for that is what these principal investigators did is they really swabbed and did more frequent looking at viral PCR and cultures. So they did more frequent swabbing and they saw that rebound was more.
So knowing the risks and the benefits, depending on who you are you going to prescribe this still?
I still am going to prescribe this to the highest risk patients. Interestingly, though, the elderly and the immunocompromised patients in the study were more likely to get rebound, but they're still more likely to get hospitalized. And people who have rebound, even though they're going to be more contagious, they tend to do well with this rebound.
So it's worth it for them in the long run.
But the patients that are on the border of being high risk and standard risk, we don't give it, those patients, I think we have to think twice about it. And the good news is that it's being studied. We think, many of us think that for some patients, you need longer than a 5-day duration. And if you were to do that 10-day duration, maybe you'd see less rebound. That's being done, that study's ongoing in Europe. There's also a new antiviral that has a longer half-life, 48-hour half-life that's down the pike. These changes may really help improve, the already good drug Paxlovid.
All right. Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Thanks for coming into the newsroom. We appreciate it. At 4:30. Ed, to you.